Hello, I'm Dr. Tubbs. Today I want to tell you a little bit about your first visit to our office. But first I'd like to tell you a little bit about my background. I grew up in Stowe, Ohio, attended Kent State University. I went to school, professional school, at Texas Chiropractic College in Houston, Texas. Following that, I returned to Stowe in 1982 and have been in practice since 1983. During that time, I've raised 5 children, and just wanted to give you a little history about the patients I've treated. I've treated babies that as young as a couple minutes old to adults as old as their late 90s. My 5 children have been under chiropractic care since the moment they were born. And as soon as the medical doctor walked out of the room, I started manipulating them, and they've grown up pretty normal for a teenager, that is. My children have not had any immunization shots. They've been under chiropractic care since they were born. None of them have had asthma. None of them have had ear tubes installed. None of them have had their any surgeries, and they've grown up pretty healthy. So chiropractic works. The reason I wanted to emphasize about young people, babies, children, adults, is that everybody has a spine and everybody can benefit from chiropractic care. So first I want to talk a little bit about the different healthcare doctors. There's medical doctors, there's osteopaths, and there's chiropractors. Years ago, Thomas Edison made a quote, and he said that the doctor of the future will give no medication, will give no drugs, but will interest their patients in health and in the care of their spines. And I think the world has evolved over the last 30 years since I started practice to recognize the importance of natural health care. First of all, I'd like to talk about some of the symptoms we treat as chiropractors. Generally, a patient comes in our office complaining of neck pain, headaches, maybe pain in the middle back or low back. They may have symptoms radiating down their arms or legs, whether it be pain, numbness, or tingling. However, even though a patient presents themselves with symptoms, our job as a chiropractor is to try and find out what is causing those symptoms. So we're looking at the cause of the patient's problem. From that point, we generally proceed with an examination. First of all, when a patient comes in our office, we just watch how they walk in. And after being in practice for 30 years, I can almost tell what a patient's condition is, their symptoms, and what could be the cause of those symptoms. A lot of times they'll be walking in an antalgic position, and you almost know that they may have low back pain. You can see the grimace on their face if they're in a lot of discomfort, and you can tell by their age, by the way they carry themselves, that they may have disc degeneration, arthritis. You can tell also by their symptoms, and after we do an examination, they could have disc involvement, herniated discs. But generally, most people have a neuromuscular problem caused by a misalignment of the spine, pinching the nerve. So during our examination in our office on your first visit, we palpate or feel your back, your neck, and we're feeling for tightness, we're feeling for stiffness, we're feeling for muscle spasms. And as I mentioned earlier, you can almost tell what the condition is there. What's the underlying problem? If it's very stiff and hard, generally you have some arthritis there, some discs wearing out. If the muscles are palpably tight, spasms, inflamed, then a lot of times you have a misaligned vertebrae pinching a nerve, causing the muscles to tighten up. The exam also consists of checking your range of motion. We have to bend side to side, rotate. We do that with your spine and your neck. trying to determine if there's any restriction in your neck or back. Following that, we check out different tests. We check out if your sensory nerves are working. We do some testing to see exactly where that nerve interference may be occurring. So if you have neck pain, we'll focus on the neck, of course. We'll check the range of motion, palpate for muscle spasms, inflammation, and we'll try and determine at what level you may have a pinched nerve. So if it's the 5th nerve in your neck, that nerve courses right down through your shoulder, down through your bicep muscle, to your thumb and finger. You may have numbness, you may have tingling, you may have pain radiating down there. But just by observing the symptoms, we can tell exactly where that nerve may be getting pinched. However, once we determine that the nerve is getting pinched, we need to know how, why, exactly what's causing that nerve to get pinched. So we recommend taking an X-ray. In our office, we have a very high-tech office, which consists of a digital X-ray machine in order to determine exactly what's causing your problem. There's less exposure from a digital X-ray machine, and it gets very good quality X-rays. Once we take the X-ray, we'll review the X-rays with you. We'll show you maybe there's something twisted pinching the nerve. Maybe there's something wearing out, a disc. You could have a disc slipping out pinching the nerve. No one knows unless you have an X-ray. From that point, we generally recommend care and treatment in order to correct the underlying problem. We'll go over in another one of my series of lectures about what we do exactly with the therapies and treatments in order to correct your underlying problems. Chiropractic works. Chiropractic is a natural form of health care. Give it a try. Thousands of our patients have done very well through chiropractic care, and it's a non-invasive science, a non-invasive health care procedure. Try chiropractic before you try drugs and surgery.